Hello, Mr. Liao's 2B biology class. This is Lizzie Ainsworth coming live from my grandmother's kitchen. Today I am coming to inform you of a major crisis. A case of Ebola has been found in the United States. And Roy Gill, who has been traveling internationally for the past 2 weeks, comes home and becomes very ill. Case and determined that he has the fatal virus, Ebola. This disease can be passed to humans by infected animals or close contact with an infected human's body fluids. According to the World Health Organization figures, Ebola has killed 1,200 people between the first recorded outbreak in 1976 and 2004. Researchers believe that the virus lives in an animal host. Even though the natural habitat of this mystery animal remains unknown, the scientists continue to search for it. Now we'll be asking Hannah, a flight attendant on the airplane with Roy Gill, a few questions. So, Ms. Hannah, is it common to see a passenger sick on the plane?
Yes, it is indeed common to have sick passengers on the flight. Most of them tend to have motion sickness.
And if someone had a fatal disease on the plane, what would your first action be as a flight attendant?
If a passenger is severely sick, we call in a medical professional, and depending on whether he or she confirms that the passenger has a fatal disease, we make an emergency landing at the next nearest airport. If he or she does not have a fatal disease, then we give them the best medical attention possible.
Do you have training with fatal diseases, and if so, what?
All flight attendants are CPR certified and know basic first aid. We also know the many warning signs for common conditions like air anxiety and motion sickness.
Thank you for your time, Hannah. And now we're going to talk to Dr. Padron. So, Dr. Padron, what would be the first steps you'd take in handling the Ebola virus?
Some advice I would have for you would probably just to reduce your risk of catching this virus as much as possible. Just keep away from high concentrations of the virus and clean your stuff with bleach. Clean anything that might have been exposed, or just really as much as you can, clean it and separate yourself from the virus. Clean everything with bleach and just separate yourself as much as possible from this virus.
As you know, Ebola is deadly. What advice can you give if an outbreak occurs?
You contact the health department or CDC and let them know what's going on. Also, isolate the patient as we did with Mr. Gill, and just make sure that you can decrease the spread of the virus as much as possible.
Thank you, Dr. Padron, for that information. Now we're going to go to Dr. Bryant, a CDC scientist. Dr. Bryant, how would you react to someone who had discovered they had the Ebola virus?
We would recommend ongoing testing for the presence of Ebola virus during hospitalization, with testing conducted every few days. Care while in the hospital includes maintaining oxygen status and blood pressure, and treating for any complicating infections. When there is no detectable virus on the blood test, the patient can be discharged.
So, for example, if a local hospital called in and said that one of their patients had the Ebola virus, what would the CDC do to help them recover?
Once the patient begins to recover, it means that the patient's immune system is successfully inhibiting the virus, so that the virus can no longer make copies of itself in the patient's body. So, the patient's body eventually clears the virus. The recovery process can be slow for those patients recovering from Ebola hemorrhagic fever.
In your words, what is the Ebola virus?
Ebola is a virus, not a bacteria. If people get sick with Ebola, we say that they have Ebola hemorrhagic fever.
What will the CDC do to help control the Ebola virus that is spreading?
Probably the hospital would ask him where he was traveling. And if he said, "I was recently in Africa," then they might ask him if he had been in places where there might be Ebola. Hospitals with any active cases of Ebola hemorrhagic fever, or caves with possible Ebola-carrying bats. If he said yes, they would suspect that maybe his symptoms suggest that he has Ebola hemorrhagic fever. If he gave different answers, they might think of other possible diseases. From that point, if they suspected that he was sick with possible Ebola hemorrhagic fever, they would keep him separate from other patients and would be wearing protective clothing like gloves and masks when they were around him. They would also notify CDC and ask what could be done to help recover.
We have just heard that the case of Ebola has spread to numerous people, all whom were passengers on the plane with Mr. Gill. These people became ill when they were infected with Mr. Roy Gill's body fluids. Luckily, when they went to their doctor and got treated, most of them were identified as victims of Ebola hemorrhagic fever. As soon as this was found out, all the passengers were contacted and sent to a hospital facility where they will be watched. They remain there and will be treated the best they can under the circumstances, but the chance of their survival is very unlikely. Thank you 2B for watching my presentation, and I hope you have a good day.